Jeff, I don't know if you have slides or not, but I'm happy to share the screen. There'll be multiple. You can throw things up or you can just talk through your work. I'm not sure what you're
I'll just talk.
Okay. Welcome everyone as you come online today. We've got about 20 in the room. We'll give it another minute or two to let everyone file in and get settled. Got a great agenda focused on food, one of my favorite things. And it's end of March, which means spring break is around the corner. Does anybody have any exciting plans?
Working more work.
Ask me too. I think spring break, once your kids are done with school, actually spring break becomes a nice little time to get work done and everybody else is gone. Hello, Kenny Lumpkin. I heard from one of your colleagues today regarding your grants program.
Greetings, Renee. How you doing?
Doing good, thanks.
Been keeping you in my thoughts and prayers.
Thank you.
Yes, ma'am.
It is one day at a time.
Yes, ma'am.
But I mean, fortunately, I have a great network of support, so I'm grateful for that. And I do think it makes it a little easier.
Amen. Yes, it does.
We'll be with you in just all right. For any of you in the sandwich generation, that was a physician calling about my 91-year-old mother. So I was like, ooh, catch that quickly.
Yeah.
Doctors are hard to, it's always on their schedule, as you know. I do think, let me ask Jesse, how are we doing? Is it slowing down a little bit? Okay. I think we're gonna go ahead and get going, and we'll let people join us as they always do. They kind of come when they can and sometimes have to drop off early, but welcome everyone to the March Gwinnett Coalition Community All Call. And these are monthly gatherings where we get together to share real-time updates from the field. We have announcements that can be shared and just learn about community-wide initiatives. And that's why we're here today. So we first are going to recognize that it's National Nutrition Month. And so we've invited a couple organizations to be featured this month and to hear about their work in honor of National Nutrition Month. So both of them are here. I'm going to first introduce Open Hand, and then that will be followed by Chef Hank. So first I'm going to do one introduction, let them present, and then I'll come back and introduce you to my dear colleague, Chef Hank. So Open Hand is one of the largest community-based providers of home-delivered meals and nutrition services in the U.S. It was founded in 1988, and the nonprofit delivers delicious, nourishing meals and nutrition education to thousands of seniors, children, and families, and our neighbors who are at risk who have disability or illness. In 2023, Open Hand cooked and delivered its 35th million high-quality, health-promoting meal to a neighbor in need. And with custom menus to address specific health conditions, all open hand meals are approved by registered dietitian, nutritionist, and they meet or exceed the most rigorous national standards set by the American Diabetes Association, the USDA, and the American Heart Association. So today we have with us Aleta McLean, Senior Director of Client Services and Outcomes, and Katie Leite, who is the SNAP Ed Program Manager. And I'm excited. I just recently learned of Open Hand, and I understand they have both a nonprofit arm and a for-profit arm, which also makes a lot of sense. And I'm just eager to hear about the work that they're doing. So Aleta and Katie, can I invite you to just begin your presentation and let us hear all about your good work?
Sure, great. Thank you so much. I'm going to share my screen.
Sure.
All right, and I'll let Alita. She's gonna kick us off.
All right. So thank you, Renee, for that warm introduction. Yes, 35 million meals is a tongue twister. So we talk about it, but we don't say it often. Um, but I'm Aleta McLean. I'm our Senior Director of Client Services. I've actually been with the agency for 20 years. So I've seen its progression from when we started off as an aid service organization until now serving just the general public and individuals living with chronic conditions who are trying to prevent or better manage their chronic disease. On the call is Katie Leite. She's our SNAP Ed Program Manager. And once I go through a little bit of our history and our meal programs, Katie will come in and talk more about our exciting SNAP Ed programs. Next slide, Katie. So we've been around now for 36 years, serving 36 million medically tailored meals to date. We serve about 5,000 meals out of our kitchen each day. So that is to individuals. We also serve as congregate sites, so senior centers. So some of those meals are for senior meal participants. We have a statewide reach. So in terms of delivery, we deliver our services to approximately 19 counties, 19 kind of metro counties. Outside of that, we're shipping meals to like Valdosta and the South Georgia areas. But that also includes what you were mentioning is our social enterprise. So we do have a social enterprise called Good Measure Meals. And with that is for the paying public. It's an e-commerce product, and 100% of the proceeds support the philanthropic side of Open Hand. We have approximately 10,000 annual volunteers. So we accept individuals, corporate groups, faith-based groups, and they are helpful in terms of packaging our meals and delivering our meals. On the weekend, we are open on Saturdays for delivery, and 99% of our deliveries are volunteers on the weekends. We have approximately 120 dedicated employees, and that includes our registered dietitians who are part of either planning our menus or in the field doing our nutrition education programming. And we have a lot of community partners, and hopefully from this call, we can develop some more and as we talk more about our services. Next slide. So, who are we serving? As we mentioned, we do meals for some of the senior programs. So, we are the senior meal provider for Fulton County, Cobb, Rockdale, Clayton, Fayette, Athens, Oglethorpe, Cherokee County Senior Services. We are a Medicaid waiver provider. We still service individuals living with HIV and AIDS as part of our mission, and other individuals with chronic conditions. We are usually serving individuals that are low income, who are either qualified for SNAP benefits or who are at the poverty level. But most of our clients are dealing with some type of nutrition sensitive chronic conditions. So to qualify for our services, they usually depend upon specific funding programs, like if you're a senior, Medicaid, or we apply for funds philanthropically for individuals with chronic conditions. So we'll have meals for individuals being discharged from the hospital. We'll have meals for anyone with a nutrition sensitive chronic condition. And then we have some diabetes specific programs as well. Next slide.
Oh, sorry.
Ooh,
My picture went away.
okay. So our core services are our medically tailored meals and groceries. They are designed again by our registered dietitians. So we're targeting chronic conditions. They focus on recipe development, making sure we're meeting certain criteria. So if an individual needs a heart healthy meal, low sodium, diabetes friendly, renal, we're able to meet all of those different meal types. We also offer some preference meals. So if they're vegetarian, no pork, no red meat, no seafood, we're able to accommodate that. And we also provide client choice. So a lot of individuals, they still want some sense of autonomy and like the person-centered approach to being able to choose which meals they receive. So we allow our clients to choose their which meals they would like to receive that are within their therapeutic requirements. And a lot of our clients, their meal type is based on their disease state, and the amount of meals is determined by the particular program that they are assigned to. For our medically tailored groceries, those are just specific to certain individuals. Again, that depends on funding, but we call it internally a market basket. So what that is a bag of shelf stable items in addition to a bag of produce and fresh vegetables. And our registered dietitians usually um, create menus based upon what's going to be in the bag for that particular week. And these are more designed for individuals who have the capacity to prepare their own meals, but they still need some type of assistance in terms of just needing healthy foods, either because of their income um, or mainly because of income or their improved disease state as well. That's the next one. So the impacts on our client health. One of the things that make us different from a traditional meal program is that we are focused on medically tailored meals, and we are focused on kind of the impact of our meals on the client's health. So for a lot of our programs, we are monitoring health either through pre and post tests. Some of them we are doing biometrics, or we are receiving biometric information from their medical provider, so that we can look at to see if we're making any improvements in A1C, blood pressure, things of that nature. A lot of our clients will report that they've seen improvements in blood pressure, weight management, increased energy, especially for those that are being released from the hospital. They are saying that the meals help them in their transition from hospital to home. So having that type of service has been beneficial. And in addition to our meal service, we have quite a few nutrition service offerings. As we mentioned earlier, we have a team of nutrition registered dietitians. So they are also licensed Medicare providers. So they're able to provide medical nutrition therapy for individuals who have Medicare Part B and a diagnosis of diabetes or chronic kidney disease pre-dialysis, which is covered by Medicare Part B. In addition to that, through various programs, we offer one-on-one education. We offer these classes in person and via telehealth. We have various group nutrition classes. We have some evidence-based programs like chronic disease self-management, diabetes self-management, and those can be, again, offered virtually or in person. And they're also able to design specific programming. So if there's topics that someone was um, wanting some nutrition education on, they're usually able to adapt. Like brain health has been one, um, bones, if it's certain conditions. We were doing some for heart health this month, last month as well. So they're able to create different topics. And then one of our other programs before I turn it over to Katie is our SNAP Ed nutrition programming, which we receive funding for to offer some additional evidence-based nutritional programming in person and virtually. And I'll turn it over to Katie to go more in depth into our SNAP Ed programming.
Thanks, Aleta, and hi, everybody. Some of you I recognize, and it's great to see you. Others, great to meet you, and looking forward to talking to you more about some of our programs. So, like Aleta said, we're a SNAP Ed implementing agency in the state of Georgia. That means that we receive funding from the USDA to offer nutrition programming, including classes and other evidence based programs free of cost at certain community partner sites throughout the state. So we do have a team based here in Metro Atlanta, and then we also have a team member in Savannah, someone in the Tifton Valdosta area, and then a contractor out in Columbus. And so we really do have a kind of statewide footprint with our SNAP Ed programming. We're also able to deliver these programs in Spanish and in person and virtually so that we can really try to fill gaps within the different communities that we're serving. We offer the SNAP Ed program based on eligibility. We use zip code to see if partners are serving zip code tracks where folks are a majority SNAP eligible. So that might not mean that they're redeeming SNAP benefits, but that based on the zip code track and the residences there, the majority of people living there would qualify for SNAP benefits if they were to apply. And that kind of just helps us know that we're reaching those SNAP users and helping them with this nutrition programming, which is really focused on smart shopping, cooking skills, meal planning, and building well-rounded healthy meals. Just to talk a little bit about some of our offerings. So we do a wide variety of different SNAP Ed programs. Kind of our bread and butter is our direct nutrition education class series. So we work with partners all around the state to host 6 or 7 week series of nutrition and cooking classes. These are hands-on, engaging classes for youth, parents, families, and seniors. We do a lot of our work with seniors throughout the state because this is a population that oftentimes is tasked with feeding themselves, but maybe they don't know how to plan meals for only one person, or they find that their food is often going to waste, or they just don't have the budget to build healthy meals. And so a lot of our classes are designed specifically for the populations that we're working with to teach them these skills and improve the way that they're eating. And like Aleta said, most of our approach is also looking to address chronic disease. And so when we're working with a chronic disease population, we're really helping seniors and any individual focus on keeping an eye on those, maybe pre-diabetic symptoms or nutrition related symptoms to help improve their health. Another one of our SNAP Ed programs is our healthy retail program. So we do these around the state as well as in the metro area with several retail partners where we host grocery store tours either in a grocery store or we will go to a partner site and kind of set up what we call a pop-up tour. And this is really designed to teach people about budget shopping, how to read food and nutrition labels, and the 5 food groups and how to build healthy meals with each of the 5 food groups represented for under $10. So really on a budget. And especially now with the cost of food increasing and most people's benefits not increasing, this has been a really popular program. It's also a one-time program. So oftentimes, I know recently with the Gwinnett Coalition, actually at your health fair, we did one of these just because sometimes a series class isn't ideal for certain populations or we just don't have enough time. So this is a great option for people. It still covers a lot of really important nutrition information. We also offer our produce prescription program through our SNAP Ed program. This is a 6-month program where participants, usually those who are diagnosed with chronic disease, receive and participate in 6 weeks of hands-on cooking and nutrition classes. And then it's a 6-month program total. So throughout the 6 months, they'll get weekly produce delivered to their homes. And we track their changes over time from baseline to that 6 months to really look at not only behavior change, but also biometric changes and chronic disease marker changes. So, for example, right now we're hosting this program with people with uncontrolled diabetes. So we're tracking their A1Cs over time, and we have been able to see a decrease of people's A1C percentages from baseline to end line through participating in this program. So that's another one of our offerings. We also partner with early care and education centers, or ECEs, around the metro area to do a farm to preschool program where we offer them harvest of the month produce deliveries, as well as in classroom opportunities for hands-on learning for the children and the teachers and the site nutrition staff to try to help promote using fresh and local foods in their menus. And we offer technical assistance to the sites through that as well. And then the last thing is we do have a partnership with several WIC clinics throughout the state as well. So we've trained a few of their nutritionists to deliver hands-on nutrition programming in person and virtually in the clinics, and then we offer technical assistance and materials assistance to those programs as well. So that's just a couple examples and some applications of the projects that we have through our SNAP Ed program. And then to talk a little bit about impact, we work with over 140 SNAP Ed partner sites throughout the state of Georgia. So a partner site might be anything from a faith-based organization to a school to another nonprofit. We also work with a lot of healthcare clinics and hospital settings to really reach their patients with this type of information and programming. So we work with a really, really diverse range of partners. Last year, from our direct nutrition education series, some of our outcomes that we reported were increased consumption of fruits and vegetables among our participants, decreased consumption of sugar sweetened beverages, which is something that we really try to push. We talk a lot about drinking water or subbing in sugar free or low calorie beverages because so many people are getting a lot of their sugar intake from beverages. We also talk a lot, and our program is really designed for behavior change. So we are measuring from pre to post people's confidence in things like shopping and talking to their families about healthy cooking and healthy eating. And we did see an increased confidence in participants around shopping for and then also preparing healthy meals for their family. So that's huge because we really want them to have sustainable attainable changes made over the course of the program, whether it's 6 and 7 weeks or something more than that. And so the confidence change is really what we're looking for. That is where we can kind of see that sustainability coming through. And then also with our, different partners and their funding, and as that allows, we're able to kind of add on to some of our programs. And so over the last year, we've been able to pair some of our meal services or our market baskets, like Aleta was saying, with some of our series classes, and this can make an even greater impact. So being able to have seniors in a 7-week class, but also provide them with home delivered groceries throughout those 7 weeks, we can see even larger changes being made throughout the course of that class series. And then, you can see this picture, all of our participants, they get to graduate, they get a certificate and different gifts at the end of the class. And they really do build community and really strong social connections throughout the series. So it's really great to be able to work with partner sites to bring these services to different communities. And I think that's all we were going to cover today. I know it was a lot of information. I would encourage you to check out our website, which is QR coded and linked here. There was a picture of our medically tailored meals on one of the slides that didn't come through, but if you're interested in learning more, you can check out our website. And then also here is our contact information, and we're happy to answer questions and then also send on further information if anybody would like. But thank you so much for having us.
Thank you, Katie, and thanks, Aleta, for that. That was so great that the service and then the health outcomes are being tracked and they're mutually reinforcing. It's really inspiring. Any questions for Aleta or Katie? So they partner with other nonprofits. So if you're somebody who's thinking, how can I bring this education into my organization and help increase the knowledge about healthy eating and reading nutrition labels and navigating the grocery store and all of its tricks, then
know about it, and this is just incredible. I just love all of these different and creative and interesting things that you all are doing. I think it's absolutely amazing, and I was involved. So one thing that they do which as part of one of these things, they did a couple recently went to Department of Juvenile Justice facilities and did cooking demonstrations for the youth and their parents. And then had produce bags and meat and breads and everything to go afterwards. And so yeah, just seeing the expansion of the work in this area is just incredible.
awesome. All right, with that, put any additional comments or questions in the chat, and maybe they can be answered over the course of time. We're going to turn our attention to another food relief organization, one a little bit closer maybe to home, and some of us know him on the call. But Chef Hank is the founder of Lettum Eat, which is a nonprofit that launched in 2019. It's a food relief organization supporting families and individuals challenged with food insecurity. Chef Hank uses professional food service principles, strategic partnerships, and is committed to community outreach to alleviate hunger in Gwinnett County and surrounding metro Atlanta counties. I have seen Chef in action and serving others in the community, and I can say he when he does his work, he does it compassionately and with grace, and it just shows through in everything that he does. So in his 6th year of business, you can imagine, as a sort of a startup, emerging mid-sized nonprofit, he's got those entrepreneurial tendencies, and he's very dedicated to his work with a full schedule. But I'm grateful that he carves out a little bit of extra time to do some social service in my organization. And I'm so proud that he is a member of the Gwinnett Coalition Board of Directors. So with that, I'm going to hand it over to Chef Hank to tell us about his Lettum Eat organization.
Thank you. Thank you so much, Renee. I definitely have to say that there's a sigh of relief to hear of all the great work Open Hand is doing with their organization. And, it's a model for what we aspire to do. Myself and the concept from Let 'em Eat, as Renee mentioned, is, me taking professional food service principles and finding something to do with over 35 years of food and beverage and restaurant experience and being able to apply it at this stage in my career. And, let me just say that God is front and center with everything that I do. And he has definitely made it possible for me to not only serve the community in a way that I feel comfortable about, but just I tell people this all the time. He has shown me that nothing that I've been through was a mistake, and there's no time that has been wasted. Some of the most challenging things that I've faced in my career in the restaurant industry have directly impacted my ability to be able to do the work that we've done for over 6 years now. So, again, thank you to a lot of the partners that I see on the call that have supported the endeavors of Let 'em Eat and what we have achieved and what we continue to try to achieve. And again, let me just say, Katie and Aleta, the work that you are doing at Open Hand is inspirational to me. Again, these are things that I'm trying to nail down from my perspective, and not only am I trying to carry I've been in the industry like I have. We get too old to be in restaurants working 70 hours a week, so we need something to do. And I'm trying to encourage as many young people in the culinary arts industry as well as the older ones to consider a life of service. I do career days at some of the elementary schools and the middle schools, and I came up with this phrase, and I'm telling these kids I'm making a living giving. And that's something that kind of sticks with them, is just understanding that everything in life, if you approach it from the standpoint of a monetary reciprocation, sometimes it's difficult to actually keep up with what that challenge is, or keep up with what you earn from that. But there's no better feeling than to give back to your community, especially in a way that you spend a lot of your time and energy in doing. So restaurants and food and beverage has been a big part of my life. And to be able to step into this arena of serving the community and fighting food insecurity, and trying to do what we can to, keep waste and foods out of our landfills, and just the mere fact that none of this work gets done at a high level without partnerships. So again, I can appreciate everything Open Hand does in regards to making it possible. So you will be hearing from me and my team. I'm definitely excited about what you have going on, and I'm a small organization, and we take baby steps, but we have big dreams and big aspirations as far as what we do. So just to kind of step back, Lettum Eat, we started in 2019. And at the time, I was on staff at one of the larger Baptist churches in the Gwinnett County area. And, people say Baptists like to eat. And that's why they brought me in, because, my goal was to take, some of those recipes and things that they like to go out in the community and eat, and put them on the table for families for a cost that they could afford. The one thing that I pointed out once I kind of started that ministry in that church was that families don't sit at the table anymore. We don't enjoy a meal the way we used to when we were younger. So I felt like, what better way to bring the same type of menu offerings that they may be able to take their families out once a year to experience, but give them this opportunity on a weekly basis. So my goal with that was, okay, well, we have families coming in, and just we started when I came into that church. They probably had 100 people on Wednesday night showing up, and half of them were bringing Chick-fil-A from the outside. And after a couple of weeks, we had 300, at least 300 people per week. Everyone was participating in the Wednesday night meal, and everyone was enjoying the food, and their families could come in, and the kids could come in. So to me, that was inspirational enough. But the question I had for that church was, well, okay, was this for the community, or is this for the club? You know, so what exactly are we doing here? So, the goal was to continue to reach out. So I use, my minimal experience with social media to invite people into the church and to come in and eat. And more people started to come. And, you just get into one of these rhythms to where things don't move as fast as you think it should move. So this is when God really started having serious conversations with me about patience, which I always thought I had. But he had to remind me that, I'm putting you here for a reason. So don't worry about what you think should or should not be happening. You just do all the things that I've given you the gifts and the abilities to be able to do. So I continued that, but I wanted to reach more people. And I ran a bunch of things by the church in regards to an idea of how we can mobilize and get outside the four walls of the church and to be able to do this. And eventually God said, give it away. And he gave me that message. He said, give it away. And I understood what he meant. I'd started a couple of nonprofits before, but I said, it gets hard at a certain point, but I'm gonna go a little further this time. So I did. I explored what to call the organization. Well, Lettum Eat, that term comes from something I tell people. If you know anything about restaurants, there's a back of the house culture and a front of the house culture, and they don't always get along. Because the people in the front, they need their food, and the ones in the back, we just want some good communication. But Lettum Eat was the statement that I always used to tell my staff when we put food up. We say Lettum Eat. They say, how long is my burger? I don't answer that question. We answer it with Lettum Eat. And I knew that if Lettum Eat never did anything, that there were probably a couple of hundred people that I worked with in different environments that would know what it meant. So in the beginning, that was enough for me, so now I had a name. So the next thing was, well, how do you develop this? We knew we wanted to be mobile. I always knew that you can't do these kind of things on your own. So you need strategic partners and just partners in general, and everything is shared. There's no secrets to what I've done and what I've accomplished that I don't share with other people, because it doesn't matter whether Let 'em Eat exists or not, as long as the work gets done. And that's the thing that makes me feel good about what I'm doing every day, and so the big part of that was getting out there and getting something done. And, we started an organization, and that's 2019. And 2020, that spring, we had planned on partnering with a couple of organizations and some other churches and schools. And, spring break, the kids, we recognize they don't eat like they normally eat because they're out of school. So we set out to serve in 5 locations that week of spring break. We served over 5,000 hot meals that week alone. And most people will remember that they never came back to school after that. We saw ourselves in the throes of a worldwide pandemic, and God gave me another message, and the message He said was now. That's all I heard. Heard Him tell me now. And what He meant by that was all this stuff you've been putting together and developing, and all the things you've been through over the years, and what you've been planning over the last few months. Now is the time for it to be put into play. And basically, the concept and the idea was there, but we had to scale up. So, we had to pivot in some instances and go from hot meals to prepackaged frozen meals. We had the space in the church, so we had the ability to be able to do the work, and we did, and we continued to partner. That first year, we served over 75,000 meals. And that was through great partnerships like the Net Church, and just, so many other different organizations that wanted to serve their community. So, fast forward after that first year, we're 6 years down the road. Now, prior to this, I had my own restaurant in the Snellville area, and it was everything I could do to stay open for 18 months because I felt like it was my time and all this different stuff. But, it's never about my time, it's always about God's time. So when I look back and realize that I'm still here 6 years later, and I'm on a call like this with so many people who love their community and done great things, I can't help but to feel God's calling on me just to send this message and to wake up every day and to do this work and to give God credit. We want big things to be able to give Him credit for, and I'm just happy and satisfied that Let 'em Eat has been a part of my life, and I've been able to do this. So, a little bit about how we go about our business. Again, it was about mobility. Coming from the 4 walls of a church and asking people to come in. The next step is, well, how do we get into these neighborhoods? We knew that there was a problem nationwide and in our communities, and especially Gwinnett County, in some areas of homelessness. And I've always felt like, an extended stay motel is not a home. So, I've never wanted to think about it that way. So I knew that there were a number of areas like that we could serve. And, we set out to do that. And then the other thing with some of these awesome partnerships, one of which was the Gwinnett County Public Library. They were instrumental in helping us get a massive amount of meals out, somewhere close to 1,000 meals a week at 5 branches, that just really gave us an opportunity to have an impact on a broader scale, and really understand what partnerships should be about. Because, from my perspective, I hadn't been to a library in I don't know how many years, but, to hear that they were interested in food and feeding their communities, and understanding that, they could take a part in at least just trying to outreach, and then that they would see a small organization like mine and see my heart and what I felt needed to happen in the community and partner with me. So those type of relationships were instrumental in us, increasing that outreach and being able to get the word out about, food insecurity. We live and work in a lot of communities that people wouldn't even think would have a need, but they have the greatest need. I'm in the South Gwinnett area, and we have a tremendous amount of need. But, sometimes in different arenas, we don't respond like that. So I feel like from my perspective, it's up to me to put my feet on the ground and really engage and love on people and see what is the need and what's really there. So I don't worry about what other people don't see. I look and see for myself. When you think about areas like this, and people wouldn't think that the Beaufort area would have a need, but they have a great need. And we've been a big part of serving in the North Gwinnett area with the Children's Home of Hope. Maureen's on the call, and again, just all these different areas. So our goal is really to be able to outreach as much as we can, continue to nurture relationships. We had an outstanding relationship with the Community Foundation of Northeast Georgia. They've been really big on supporting our organization and getting the word out to their donors. And again, we're not a huge organization, but I feel pretty good about the level of responsibility that's been placed on me, us, our organization to just do what we can in the community and not trying to outrun our reach or to move too fast. We like to be bigger than we are, but we understood that the start of this organization would involve a really good idea, someone to put a face behind it so that I could always speak positively about what it is we intend to do. And also, to be able to have the capacity to build the assets necessary to mobilize, what we do. So, our goal is hot meals, prepackaged frozen meals. Initially, I built my first food truck, and you do what you can with your hands, and then God blessed us through some COVID funding with a brand new food truck. So, I was telling somebody the other day, it's a big difference between, wanting to run a food truck and have something and you only have a certain amount of money, but you never know if that truck's really going to crank up when you need it to. Well, God made it possible for my truck to crank up all the time and for me to have everything I need to do what I need to do wherever wherever it may lie. I've been to Augusta, Georgia during hurricane relief. We just did a trip to North Carolina 3 or 4 weeks ago where prior to that a week they still finding people who've been cut off from the world. So there's a need everywhere. And my goal is to try to lay out a plan for Lettum Eat that can be duplicated. I want to see an organization in Birmingham, Alabama, and Tennessee, and other places. And it doesn't matter whether they look at my website and body of work and figure it out for themselves, or we work together to make it happen as long as it happens. But it's just very important that we continue to grow. Some of our outreach now continues to be at the extended stay motels. We currently have a small group that goes out once a week, and we package what we call meal kits. Right now we don't have the kitchen capacity that we had when we were working out of the churches. We do have some small satellite spaces that we work out of, so we can continue to do that. But the meal kits are basically where we kind of strategically pack boxes that will make up to from anywhere from 20 to 30 meals for a family on a weekly basis with bread, protein, dairy products, some vegetables, things like that. We've been able to continue to accomplish that. But, currently we are in the throes of having a community kitchen built in the Norcross area. So, I mean, this idea is 3.5 years in the making. We found some decommissioned classroom trailers from the Gwinnett County Public School System, hired an architect to design kitchens in these trailers, and the hope was to find land partners, which we did, the Net Church, which has been one of our long-standing partners, to just offer us a space instead of us coming into their building. Just give us the space. We'll bring the building. So this is where we are now. This project is moving along, as fast as it can with all the obstacles of planning and development and contractors that, don't want your child or your firstborn in order to pay for the project. We've been able to get as close. All the permits have been approved. So now it's really just about getting some shovels in the ground and making it happen. But our goal is to have our first community kitchen in Norcross open by the summer. We've estimated the ability to be able to generate 1,000 meals per day out of this particular unit. And behind that, we have 2 more units that will be looking for land partners or our own land to be able to set up and establish so we can continue this work in particular. So, that's kind of where we are with Lettum Eat. We are happy with just being able to partner with so many people in the community to do the work. I often don't think I deserve all the credit and kudos that I get because I'm just doing the work. We're just doing the work, and we're just looking to stand next to people who want to serve in their community in any capacity. And it just so happens that I do food. I told people if I was a mechanic, I'd be doing the same thing and helping people get their cars on the road and be more productive. So I just try to talk to people about what is it that you're passionate about, and if you're passionate about it, you have to put some action behind it. So that's the gist of Lettum Eat. We're excited about our future and what we have going on. We're currently also looking to buy some land because we want to do some community farming. We want to work with individuals because we see challenges maybe in our future. So we would just want to make sure that whatever we can offer people to prepare themselves, as well as any kind of resources they can get in the community, that they'll have some opportunities to be able to kind of fend for themselves as well. So, I hope that
Thank you.
description about, who we are and what we've done has been great. I'm sorry I didn't have any visuals, but again, we're definitely just trying to get ourselves to a point to where we can continue to serve in the community.
You have some great comments in the chat, Chef Hank. So as I transition to the next speaker, let me thank you for that. It is a powerful and heartfelt story, and really a lesson in leadership at every level. So good work. Real quick, as we kind of round out the call today, and I hope we're going to save a little bit of time for Q&A or just announcements, I want to share yet another organization that is in the food space called Ritaza. It's a woman and minority-owned B Corp and social enterprise that strives to make local food more accessible and affordable. It directly supports our community's farmers, reconnects consumers to food and their planet, things that I think are so important, and then feeds families and individuals struggling with food insecurity. So without further ado, I'm going to turn it over to Kashi Siegel. She's the founder and CEO, and Mariah Freed, who's community access manager. We just want to hear more about your direct food programming. So thank you both for joining us today. And we have about 10 minutes left.
Hi, everyone. Thanks for having us. We can go through this super quick. But as you heard, we are working with food, working with our local farms, and also with partners who work with our hungry in our communities, our neighbors. So we got started during the pandemic. Farmers were throwing out produce by the record tons of pounds and milk by the record tons of gallons. And our neighbors were lined up at food banks in record numbers. And so really wanted to figure out how we fix this resource allocation problem. It wasn't a supply problem. It was just that we weren't getting the resources we had, which is this amazing food, to the people who needed it. Because we have such little time, I'm going to let Mariah do a bulk of the talking, but this is a sense of what we do as a company. We are for profit, so we do wholesale procurement, where you order from our order availability. We have a weekly availability list. You can order from us. We'll deliver directly to your organization. We have some other ways that we get food to companies. And then our RX program is our direct to community program. And this is how we get food directly to the communities who need it. We're actually working in Gwinnett right now. So we can talk a little bit more about that. Mariah, do you want to talk a little bit more? Yeah.
Can y'all see my screen okay? Okay. I didn't hear like objections. I was like, cool, I think we're good. So my name's Mariah Freed. I'm the community access manager with Ritaza. So I oversee our direct to community programming. It's most of it is with partnerships that are place-based with nonprofit partners throughout the state of Georgia. A lot of our work is in the metro Atlanta area. So a lot of what we do is figure out how to get local food, so Georgia, mostly from the Atlanta metro area or where the folks are based, affordably and accessibly to folks who otherwise cannot access it. We know most food at the grocery stores, maybe it's affordable, but it's not local. It loses nutrient density in transit. You don't have that connection to the farmer. We don't know what's in season. So we really want to emphasize that reconnection to farming, the accessibility piece, the affordability piece. And then we also, through partnerships, engage by providing wraparound services so that we can provide additional benefits to our customers. So right now we're working with the American Heart Association up in Gwinnett. We're partnering with Four Corners Primary Care Center in Norcross right now as well. And then a big piece, like I mentioned, additionally, is the affordability piece. So we offer discounts at all of our markets. We love to add a discount wherever we can. We do half off for clients paying with SNAP and EBT through our partners with Wholesome Wave Georgia and their Fresh for Less program. We also do senior discounts, student discounts, like discounts for people that work at the partner site. We just love to add a discount whenever we can. So one of the ways that we get food out into the community where folks usually cannot access it is through our Rataza mobile market. So it's what it sounds like. It's a grocery store on wheels, predominantly produce. So we do, fresh local produce. We can drive this out to anywhere. We bring the staff, the point of sale system, the internet, the electricity. Like we really just need a flat place to park it and we can have people come up and shop. Right now, we're going to be up at Four Corners Primary Care Center on April 7th in Norcross with our mobile market. So you'll see it in the parking lot. It's like a big billboard. It also just gets a lot of attention because it's cute. It has local art on it. And then we also stock some shelf-stable goods. So we have enough that anyone could stop by and make a meal where it's really convenient. We have local grits, honey, rice, and then produce as well, seasonal, and then some culturally specific things that might be requests or that clients really want, like fruit's always very popular. We also do what we call a farm fresh market, which is more of a pop-up market farm stand. So we can go into a community center, a church, and have a tabled experience, maybe when it's a little bit colder. So as you can see in the picture here, this was at a local health facility. We're able to table inside. So we add that convenience piece. So maybe people don't have to make an extra stop on the way home to get good, local, affordable produce. And then a newer offering that we've introduced are our produce, prescription, and nutrition boxes, where we're working with clients throughout the state to pack and distribute nutrition boxes. So these can be, nutritionally tailored or general mix boxes. We offer add-ins such as protein, so you can do meat, eggs, dairy, all sourced throughout Georgia. We're able to get a well-priced local egg right now, which is a hot commodity. So reach out to us if you want to add in some eggs. And we can offer those throughout the state currently and are able to transport them. So just because I know we're a little bit pressed on time. So in 2025, we are expanding. We're going to be launching some new markets within the Atlanta area. We have one market that we're wrapping up now. I think we're going to be at 10 by the end of 2025. So follow us on social media to keep an eye out for when we're going to be in your area. We're also looking into delivery right now so that we can offer the Fresh for Less discount on delivery, because we know transportation can pose a big barrier to food accessibility right now. In the images here, we have Mike from Wholesome Wave Georgia, who's a great partner doing senior nutrition classes for us at a center in Atlanta, where we're going to be launching some programming shortly. And then, like I mentioned, expanded item selection because we want to maximize convenience. We know, I could eat just produce for dinner, but I don't think most people want to. So we want to offer stuff that means, if you have the kiddos and you're in a crunch, you can make a meal just from stopping by and don't have to add an extra stop in your day. And with that, I'll post our contact information here, and I can also drop that in the chat along with our flyer for the market next Monday. It'd be great to see y'all. I'll be there. Come say hi and chat. And thank you so much for having us on the call as well. And we have 5 minutes, I guess, if people have a few questions, or you're welcome to email us.
Thank you for that. Those vegetables in the picture look a lot better than what I happen to buy at the grocery store.
They were harvested the same week, like we know our farmers, we want everyone else to as well.
I mean, that's brilliant, actually. I think it's so lovely. And probably some connections maybe from some of the food service providers here today as well for you. But thank you for being here and both of you for sharing. Are there questions for the Rataza team? What happens often is that people will there's like make notes in the chat. They're picking up people's contact information and you will hear from them, maybe not today, but maybe in the coming days. Well, anyway, thank you both for being here and just enjoyed learning so much about your work. I already knew about Chef Hanks, but Open Hand as well. Any other general announcements for the group on the phone today? Things that are coming up that you want to make folks aware of or need help with or
Yes.
concerns about? Yeah, Shelly Ann, hey.
Hi, how are you, everyone? So I'm getting ready to share something. Oh boy, I hope it didn't disappear. Well, Help for Healthcare Professionals. We support healthcare workers and first responders, aspiring people who want to join the healthcare workforce, as well as those who are practicing and want to move from the bedside but stay in the healthcare workforce. So we have our Youth Med Mentorship Program in partnership with Northeast Georgia Health for youth ages 13 to 20. Some of you may have already received the email that applications are open through April 15th, and we have a physician pathway at the sites are all Northeast Georgia sites, from Physicians Group to Brazelton to Gainesville, Lumpkin, Habersham. So that was a strategic partnership for us to be able to help the next generation of healthcare professionals come on board. So we track the students over time and give them exposure to the various health career pathways, as well as provide them with one-on-one experiential learning opportunities with neurosurgeons and the like. So yeah, last year we started it in our pilot. The youth, 22 students graduated from the first cohort. They were able in about 4.5 weeks to accomplish 938 hours and in 16 specialties. So some of them saw neurosurgery, heart surgery, and different things like that in 16 specialty areas. So we're grateful, and the program is open. And I think it erased from the chat, Renee. So what I'll do is I'll probably just have to drop it to you if you can share it with other people. I was typing it up to send it, and then I think it just got bumped. So I'm not sure. Sorry
So
about
the
that.
challenge is there's not really a distribution list from this call. So Shelly Ann, type fast and get it back in the.
Okay, all right, no
Yeah.
problem. So let me at
So
least drop the
stay on.
flyer.
We
and
won't
then
like
we'll take
end it
from
right
there.
at 5 if people are doing things. There's more information coming in through the chat. Any other live announcements from anybody on the call? Thank you, Shelly Ann. It's great work. We need more healthcare professionals. That is for sure.
Yeah, yes, we do.
Just want to remind
All right, I
everyone.
dropped it.
Hey, Terry.
Hey, everyone. The resilience event was wonderful. Thank you. Just want to remind everyone that tomorrow, not only is it my birthday, but it is National Volunteer Appreciation Month. So we want to remember our amazing volunteers and sow some seeds of love and compassion into them. Also, our diaper distribution is going really strong with Helping Mamas. We appreciate that partnership. We couldn't do it without them. And we are going into our 8th cohort for Career Online High School. So if you know someone over the age of 19 that's looking to obtain their high school diploma within 18 months virtually, please reach out to me. And you guys have an amazing, amazing month.
Thank you.
Happy birthday.
Thank you.
I actually put in the chat a couple minutes ago. We've got, just from a schedule perspective, we've got our all call on April 28th, and in May we're going to move it up a week because of Memorial Day. So it'll be May 19th. So make a note on your calendars. We'll also be sending information out through the exchange. But any other announcements?
Me really
Hey,
quick,
Kayla.
Renee,
Oh, yes.
really quick. And I'm going to be really fast.
Yes, you are.
Can
This is
anyone see my screen?
Yeah, Kayla Peoples, extraordinaire.
Hi, everyone. I'm Kayla, Senior Marketing Engagement Coordinator with Gwinnett Coalition, and doing my routine vaccine information all call roundup. I'm going to be really fast and not take up too much of your time. So I just wanted to share today's theme for the all call is health equity. And talking about vaccines. So I came across a very interesting research report by urban.org, if you are familiar with it. Were they're one of the partners with the partnering for vaccine equity with the CDC. And in year 3 of their program, they launched at the height of COVID in 2021, I think. They did a report in discussing vaccine equity and communities that are underserved and uninsured. So the QR code to access that report directly is right here. And then also, I want to give another resource. If you aren't familiar with the Vaccine Equity Project, they are a great tool where you can access their resource library. It's completely free. They have toolkits, presentations, social media content, also in various languages. So you don't have to uh, they say reinvent the wheel with information. The information is right here amongst us, a great community that's just sharing information. And then also, as we're getting into April, in addition to March being National Nutrition Month, and I think Miss Terry just mentioned Volunteer Month as well. Also, there's a lot going on with health observances. So also this month is National Minority Health Month. If that's something that you want to put on your radar, April 7th through 13th is the 30th annual National Public Health Week. Also, towards the end of the month, National Infant Immuni- Immunization Week as well. And then also wrapping up April is World Immunization. I hate saying that word. I'm sorry. Immunization Week. So these are just it's so much going on in April, but these are just ones that I wanted to highlight that are connected to vaccines. So that's all I want to share.
Thank you, Kayla. And with that, it's 5:02, and thank you so much for joining us today. We will see you next month. We'll have another great program. And thanks, Eliza. I thanked you in the chat, but thanks, Eliza Gevertz, for helping to put today's program. 3 fantastic presentations, all about the things I love, food and nutrition and good looking cabbage on that screen. I'm going to go get some. All right. You guys have a great rest of your week. And thanks again for joining.
Renee, can you hang
Yeah.
back? I just have a
Sure,
question.
sure.
And if others are on, they could help as well.
Okay.
Since our youth med program is with Northeast Georgia, we have all the waivers and everything signed, but we figured out transportation because we want to be able to offer transportation to some of these students who can't get to the program. So we're seeking partnerships, Uber and Lyft, and there is a system up in Hall County that could get the students door to door. And we do have our vans, so we could do that. But if anyone else knows of any transportation options to get some of these Gwinnett, I'm a Gwinnetian. If I could get some of my Gwinnett kids to Barrow or Brazelton campus, we could get them scheduled in so that they could take advantage of the experience as well.
Okay. And that's like a daily thing for X
Well,
amount?
no. It depends on how we schedule it. So
Oh.
the minimum hours over the 6 weeks period, they're supposed to do about 24 in-person hours.
Okay.
We provide them with weekly workshops, but all of that is virtual on career readiness and road mapping. All of that stuff is virtual. It's just for the days that they need to see their mentor. So if we identify, applications are open now and there's specific questions in there. So if we identify students with transportation barriers, then what we do is we're trying to get them into like a 1 week, where even if we have to take them every day to be every day for 1 week, and they'd get their 24 hours in, and then maybe the day we do CPR, I'll get them an Uber. The day we do something else, I'll get them, up to Gainesville if needed.
Sure. Shelly Ann, I don't
So
know.
it's creative scheduling.
I don't know if this would work, but I wonder if you could make this a volunteer Gwinnett project where people signed up to provide transportation.
Oh, to shuttle them, and then we just do. We have the waivers saying that anybody affiliated with us.
I do not know. I'm not.
Okay.
I'm not employed by Gwinnett County, and I don't really know that very well. But I mean, it sounds like a worthy kind of volunteer effort, right? To get
Yeah, because
kids
if you
going.
just take them, and
Mhm.
then how do we know some of our people in Gwinnett? I'm sure there's plenty of Gwinnett people that work up at Northeast Georgia somewhere. So no, I do like that. But
Yep.
yeah, okay.
That'll be a
So
thought, and I'll continue thinking.
all right, no problem. And then maybe we'll connect an email and just keep brainstorming. But if
Sure.
anyone
I
has
don't know
any
if anybody else, they've got some smart people on
ideas.
the, whoop, one just dropped off.
Okay.
Well, I was thinking DePriest might have some ideas, but
Oh yeah. Mhm.
Yeah.
All right. Well, if you think of anything, just let me know, and then I'll see who I could connect with from Volunteer
volunteer
Gwinnett.
Gwinnett, yeah.
Because yeah, I had somebody already reach out. She wanted to fill out the application, but she lives in Tucker on the Gwinnett side.
Oh,
But
yeah.
the closest place to her is Brazelton, which is still about 45 minutes away.
Sure.
So things like that. And again, she wouldn't have to go every day. It could be one day a week. It's how we schedule it.
Sure. Well, so
Mhm.
great to
I
see
had
you
a,
on
I-
to.
I'm sorry, I had a
Oh,
quick question. Shelley,
Uh-huh.
this is Earlene with United Healthcare.
okay.
Do you have you said you had vouchers?
Vans.
You
I have a
have
van.
vans.
Yeah.
Okay,
Mhm.
because there's an organization by the
Mhm.
name of Common Courtesy.
Okay.
And so it's kind of like, and they have a relationship with Lyft and Uber.
Okay.
There is a cost factor, but
Yeah.
if you email me, I will
Let me drop it in.
connect you with them,
Okay.
and I can drop my email in the chat right
Yeah, I'm
quick.
doing mine too.
And
Yeah, that would be
because they might be able to provide you with some type of assistance.
okay.
They
No problem.
typically
Perfect.
deal with people who are going to the doctor, but
Mhm, mhm.
again, you never know.
Yeah,
Mhm.
it's transportation resources, and they've probably
Right.
already vetted a lot of that. We've been typically using. Last year, we did have the waivers, and there were only about 3 students, but this year it was one of the high priorities of the healthcare systems. So essentially, they pretty much gave us a grant to program manage and do the logistics and everything of the program. So,
Gotcha. So please email me and I will connect you.
okay, all right. So hold on. All right, you dropped Arlene.
Arlene? Yeah,
Yes,
it's in the chat. What is your role, Arlene?
I'm a community engagement manager
Okay.
for United Healthcare.
All right, there you have it. Thank you. And you said
All
common
right.
common courtesy.
It's called Common Courtesy, and they typically deal with the older population,
Yeah.
but there are awesome couple that founded the organization. The transportation is a rideshare service. They
Okay.
have contracts all throughout Gwinnett County, even some other states.
Okay.
And they typically really work with different organizations for the need to get transportation
Mhm.
for different situations. They do a lot with Grady. They do a lot, just with in the community.
Okay. Okay. Good to know. But thank you so much, because it's something
Um,
similar that they have in Hall County, and I was just saying I don't know if we have anything like that because ours isn't as developed. The little
Gotcha.
the accessoride type of thing that we started up. All right, let's get off our call.
Okay, but please
Thank you
email
so
me.
much.
Thank you.
All right,
Bye-bye.
take care. Bye bye.
Bye, everyone. So glad you could join. Have a great day. Bye. Thanks, Jesse.